There has been so much discussion about how to even begin to fix our ailing health network in this province that any help, obviously, any suggestion is taken seriously and hopefully works. But you heard just now, if you heard the news, the 811 system set up, and that was the health minister, Christian Dubé, talking about it, has been a success to the point where it's been too much of a success, and that means it's broken down. Too many calls from people, too long to hold to be able to finally speak to someone. That's one aspect. Another is having allowed nurses, or finally allowing nurses, to have a nurse-run clinic in Quebec. This is the latest attempt to unclog our ERs, and it's finally gone beyond "we hope we can do this" to "we've done it." The first one is, in fact, now in operation. LINA Spagnolo is Director of Nursing at the CIUSSS de l'Est de l'Île de Montréal. She's on the line right now. Ms. Spagnolo, thanks for being here today.
Hello, how are you?
I'm good, thank you. Listen, I guess the first thing I should ask is, are you finally excited this thing has actually gotten off the ground?
Extremely excited. My team is extremely excited. And in fact, this is possible because there was a legislation that was adopted in January of 2021, which allows nurse practitioners now to provide several types of medical care. It wasn't always the situation here in the province. Since 2021, it's possible. So this is, we're going in the right direction.
All right. So can you explain for people hearing this, which sounds good because it is designed, of course, to relieve some of the pressure in ERs, and we all know how bad that situation is here. How do people take advantage of this? How does the system work in actual fact to be able to get to one of these clinics?
All right. So because the objective was to relieve the ER, for sure the primary references will come from our emergency departments. On the East End, we have two major ERs, Maisonneuve-Rosemont Hospital and Santa Cabrini, which are amongst the ER departments the most busy. Lots of overcrowding. Our teams are overworked. So references come after triage. So patient presents himself. Okay. Is triaged by the nurse and then can be referred to our clinic if it's a non-urgent situation, or via the 811, via the GAP, the Guichet d'Accès Première Ligne.
So you heard me mention, as much as a success as the idea was of setting up that 811 system, you heard now the province is looking for nurses because the system is basically overwhelmed.
Yes, everybody is calling, and in fact is very popular, especially for non-urgent situations. So we can think about like a cold, an ear infection, a urinary tract infection. So these are not reasons why we should go to the ER department. We have to find other ways to be treated.
Have we seen increases? It seems to me there's been talk forever and ever about giving extra powers to nurse practitioners. Is that in motion? Is that going to be happening?
Yes, in fact, as I mentioned, because of the legislation, nurse practitioners can now diagnose diseases. They can prescribe diagnostic tests, for example, an ultrasound. They can do an invasive technique like a skin biopsy or a lumbar puncture. They can determine medical treatment, for example, if you would need physiotherapy, administer medication. They can do sutures, joint infiltrations. They even provide pregnancy follow-up. And all this has been possible because of the legislation adopted in 2021.
That's fantastic. It seems to me it took a far too long time to happen, though.
It did take a while, considering that these models, like what we're implementing today, is not an innovation. It has been existing in other provinces. For example, in Ontario for over 25 years. We've seen models in the United Kingdom, in the United States as well.
I'm wondering, at the end of the day, I know the idea was to set up several clinics. You're the first one. How many will there be by the time this project is, in full operation?
One in the East End, the CIUSSS du Centre-Sud has also manifested their interest, and so I think they're working on a model that will probably open up later on in the spring, as I understand it. And then for sure, our model will have to be evaluated according to the results. Possibly a model that could be implemented elsewhere in Quebec as well.
Who should not be using this clinic? Like, I understand that, there's a very broad range of people for whom this would be a good fit. When would it not be a good fit?
Definitely for whatever is of urgent nature. So what you would think really like a very urgent medical issue, you don't come to this clinic. You go directly to the emergency. So the idea is to have the right service and the right place being given by the right professional.
Okay, I'm wondering, because people, whenever they hear there's a new sort of system in place, they want to run there and do that as quickly as they can without having to be subjected to waiting in an ER. But I want to clarify what you said off the top, Lina, and that's the fact that this is not about you get to go there first just because you decide, there's a clinic that's open up here and there are nurse practitioners. You need to basically be referred, right?
Yes, it cannot be a walk-in clinic.
Okay.
We don't want people to line up in front of the CLSC and wait to be seen. It cannot be that. As I said, our approach, because of the urgency of the matter, and we see in what state our ER departments are, even this week the numbers are extremely high, we have to start with this approach. The model will probably evolve over the course of the next coming months. We will see what the results are, and we'll have to adjust, but we have to start somewhere.
Okay. Starting somewhere is a nice step. I mean, we've been talking so long about starting somewhere, and it's nice to see this is up and running. So I just wonder,
good news.
Yeah, I wonder too, with the other nurses that are there with you, these have come from different parts of the city, from different clinics. Where are they all from?
They're presently assigned in the GMF or the Groupe de Médecine Familiale or in our CLSCs. We're in a transitory period right now in order to begin today because we put this clinic together in less than 30 days. It's been quite a challenge. And so all our nurse practitioners, as of today's 4 o'clock, they're giving voluntary overtime hours to put this in place. However, we did post 3 permanent positions, and the postings go down tonight, and I'm told that we do have 3 candidates on those positions. So it'll be our way of stabilizing the team, in which case we will not have to resort to overtime hours to get this up and running. But it was just to begin. We had to start, and so this was the only way to do it.
That's great to hear, Lina. And with regards, we hear all the time about just the shortage of personnel and specifically a shortage of nurses. When it comes to nurse practitioners, what is the situation there? You say you have 3 positions open, you have 3 candidates. Is there a lack of people to fill jobs, generally speaking, when it comes to nurse practitioners?
It's for sure there where we don't have all the necessary nurse practitioners. The issue is that they have to have their training. It's a master's degree plus an advanced nursing degree that is necessary. So the universities have to open up more to be able to train these nurses. So for sure, we are missing nurse practitioners in the province. We're just about 1,000. You remember the government saying we'll have, by 2025, we'll have 2,000 nurse practitioners. We're not there. We still have to do better.
Yeah, I think we can all agree we have to do better,
Absolutely.
But this is a huge step. So first of all, as I said off the top, congratulations to you. It's nice to know this one is working. I know it's going to be monitored, and there will be others to follow, which is great news for everyone. Thank you so much.
Thank you. Thank you for having me.
Lina Spagnolo, Director of Nursing at the CIUSSS de l'Est de l'Île de Montréal. And it's important. Yeah, it is encouraging, and it's good to know as well that it's not a one-time deal. If this works, and there's no reason to think it won't, we're going to see, she said, this expand to other parts of the city, which is great news. Hopefully the rest of the news that follows is if you call 811 and you're directed here, great, you can go, but first you got to get through to 811. Mm-hmm. And that's the problem right now. You heard the number of calls flooding this system, right? 8,000 calls, and people are overwhelmed. They're looking for 8,000, I think, people to be able to man or woman these phone lines, because that's the kind of outreach there is here.
Well, I think, too, about a friend of mine who is a nurse practitioner who was so frustrated for so many years knowing that she was capable of doing so much more, but being limited in what they were permitted to do. So knowing that that's being broadened, this truly could be a game changer. Listen, it's not going to change things overnight. I mean, this one clinic will alleviate some of the pain, but going forward, this really could change things drastically.
Seems the right way to go, no question.